Hey, I'm back here with Dr. John Bridger, who's with Santa Barbara Podiatry.com. He is the foot doctor in town, and he is as good as it gets at this stuff. So today, thanks for answering all these questions for us. First of all,
of course.
But Dr. Bridger, I want to ask you about something I think is fairly common, and certainly I've had myself. Is with your toenail, all of a sudden you look down and your toenail looks dark, or discolored in some way, right? So I've had this happen to me and it ended up being nothing, but there's all sorts of things that could be, right? So what are some of the things? You could start from maybe the most common to the least,
Well, it can be a lot of different things, and oftentimes, actually what most people think immediately is a fungal nail is what comes to most people's mind initially.
Fungus in your nail?
Exactly.
Okay.
Yeah, and so that's it's kind of gross to think about.
Yeah. But how do you get fungus in your nail?
Yeah, so fungus is around. A lot of times people are afraid that it's a very contagious thing, but really it's around, it's on your skin, and so it's when the environment is right in the nail that the fungus usually takes hold.
Okay.
So that can be either if you have a fungal infection in the skin, like athlete's foot, or if the nail is getting kind of loose. You can get a buildup of dead skin and moisture underneath the nail, and that creates an environment that thrive.
Got it. And so how does that, when you get fungus in the nail, what does that usually look like? Maybe we could put something on the screen here and you can tell us what we're looking at.
Right. So fungus in the nail sometimes it starts at the very end of the nail. Over time, it'll encompass the whole nail. And what happens is the dead skin that is under the nail will get infected by the fungus. And so the fungus will, in the right environment, continue to thrive. And as they thrive, your nail gets more and more discolored and more thick. But at the same time, that's not the only cause of discolored nails or thick nails. Many times, the matrix of the nail, which is at the base of the nail where the nail grows, can be injured. And that can cause thickening and discoloration of the nail.
And we're not talking about serious, just like bumping into something that you might not even notice, right?
Even less than that, actually. Just your daily walking, bumping into the shoe, which you probably don't notice at all. Yeah. And so, for example, runners can get it really severe where their nails actually fall off. But for the average person who's maybe not quite that active, they get thickened, discolored nails.
And is that usually also sort of a dark brown, the same kind of color as a fungal nail, or what?
So that depends. You might be talking about something slightly different. Sometimes you can get some bleeding under the nail, and that's particularly common again in your active population, because of the pressure against the shoes, and that's called the subungual hematoma.
Right.
And that can be anything from something really mild to something that's more serious, or even causes the nail to need to be removed or to fall off on its own.
Yeah. So what else could it be?
So other things, you have to be careful. It's rare, but there can be cancers that can cause discoloration.
Like a skin cancer.
Exactly, a skin cancer there at the base of the nail or under the nail. And so in rare circumstances, you have to biopsy either the matrix of the nail, which is again where the nail grows, or you have to biopsy the skin under the nail to make sure if it is a cancer that it's properly diagnosed and treated.
What typically looks different compared when you look at these different kinds of problems? If you could kind of just visualize if somebody's looking down at their toe and it looks brown or black or whatever. What are the different kinds of, the way these things look? How are they different with one another?
So fungus and traumatic changes to the nails can look really similar. Oftentimes there's yellowish or greenish discoloration as well as some thickening of the nail. The biggest difference is in fungus, it more commonly starts at the very end of the nail.
Oh, okay.
Whereas,
that makes sense. It's kind of pulling in, right?
It's coming in, exactly. And then when you have trauma, that trauma is at the base of the nail where the nail grows. And so in trauma, you'll more commonly see thickening and discoloration at the base initially.
Yeah. So let's, maybe we'll put a picture up here of you were talking about skin cancer, the melanoma, right? That's like the absolute worst thing.
Right.
So tell us some of the characteristics of a melanoma of the nail.
So a melanoma, more commonly, you're going to see a dark spot. Sometimes if it's at the matrix, you'll see that dark spot extending with the nail as it grows. Other times, just like you can have a melanoma anywhere on your body, it can also be underneath the nail. And so it often it can look like a mole that may not be suspicious. And then if you see changes, just like the same as a mole anywhere, that can turn into a melanoma that needs to be treated. So especially if it's painful, then that needs to be inspected and biopsied.
And actually you bring up a good point, because moles can pop up anytime, right? I mean,
Right.
people think usually, well, if I haven't had a mole and I'm 30 or 40 years old, then it has to be something, but it can be a new mole.
Yeah, it can. And so it can be one that you've had for a long time or a new one. And if you notice changes, that's one of the most important things to keep an eye out for.
So a while back, a few years ago, I looked down at my toe and it was like, it was dark.
Right.
And I totally freaked out. So I was like, the first thing that I thought in my head was, oh my God, it's a melanoma. This is
Right.
terrible, right? And it ended up being fungus. But, and I happen to be a physician. So if it's confusing to me, it's going to be confusing to a lot of people.
It is.
So maybe the smartest thing, if you've got that kind of problem, the safest thing is just to have you come take a look. How do we get a hold of you?
The best way to reach me is at my website, santabarbarapodiatry.com, and I'd be happy to see you.
Thanks for all the information.
Of course.